Good evening, Saints. I'm Christina Robinson, and I'm bringing you a brief PSA about the hantavirus. It is raining pearls and diamonds as it is the 30th anniversary of when a mysterious pulmonary illness plagued the four corners of the southwestern United States. A young, otherwise healthy gentleman presented to the ER with acute shortness of breath and flu-like symptoms, and shortly thereafter passed away. It was later learned that his fiancée had passed days prior and she had similar symptoms. This was key in identifying what was causing this cluster of cases. Scientists and medical professionals collaborated and ruled out any parainfluenzas or other potential viruses due to symptoms the patients were presenting with. Patients were presenting with shortness of breath, muscle aches, chills, and fever. After testing was completed on the deceased patients, after biopsying their lungs, scientists were able to confirm that they did in fact have the hantavirus. To isolate cases, the medical community and scientists conducted a study and trapped as many rodents as possible where the man had resided. They found that the mice and rats were carriers of the virus. How is it contracted, you ask? Well, rats and mice who are carriers of the hantavirus excrete the virus through their saliva, urine, or feces, and if a human is around the excrement, they can breathe in the virus as it is an aerosolized inhalant, and once infected can take anywhere from 1 to 8 days to show mild symptoms and 8 to 14 days to show latent symptoms. It is important to seek treatment immediately, as this can cause acute respiratory failure, and there is no cure or vaccine available. If infected, they would need aggressive treatment of oxygen therapy and medications to help alleviate symptoms and prevent respiratory failure. So please be cautious if you come across or contact with a mouse or a rat, as you do not know which mouse or rat is a carrier of the virus. And use precautions when cleaning and come across either a dead rodent or their feces or excrement, and use gloves and a mask. And thank you. Have a good night.